Supportive care is something that people haven't really heard about. It's basically everything in cancer care that isn't doing the chemo, the radiotherapy and the surgery. As you think about it like that, you realise just how important supportive care is. Supportive care is what means we can give incredibly immunosuppressive chemotherapies that, if we didn't have supportive care, would mean that infections or severe problems ripping apart the linings of the mouth and guts, mucositis, would mean that nobody could go through that and may even die of the complications. Supportive care is stopping people being sick and feeling sick. It's about getting the calories into them so that they've got the energy and the ability to keep going through the cancer treatments. And it's about managing what it's like to be a kid or to have a family that's got a kid with cancer in it. It's managing all of those social and psychological things as well. Everything that you think about in care around cancer, outside of delivery of anti-cancer treatments, is supportive care. It's important because it lets people live through their cancer journeys, but more than that, it actually gives you a survival advantage. Like I say, with infections, we know that infections are the cause of death in a fairly significant chunk of the children who die going through cancer. It isn't the cancer that kills them, it's the infection. We know that without giving the right treatments, which put them at risk of that infection, then the cancer would get out of control, the leukemia would be untreatable. So there's this enormous balance to be struck. And doing research in supportive care is about minimising the chances of those complications happening, both in the short term and the longer term. And how do we deal with those complications quickly and effectively? Back in the last millennium, in the 80s and 90s, when we had very, very few anti-sickness drugs that really, really worked, some of the chemos we give were really very, very horrible. They made you throw up a lot. And it wasn't unheard of, even in the UK, for people to stop treatment because they couldn't cope with the sickness that was generated. Supportive care research has meant that we've got better anti-sickness treatments. That means that abandonment for nausea and vomiting is almost unheard of. In that way, supportive care gets children through cancer and alive in a way that wouldn't have happened without it. When we've looked to see how important is supportive care in terms of how much survival do you get out of it, we looked at all of the deaths in Leeds of children with cancer and have been through stem cell transplant, which is a fancy word for bone marrow transplant, in around about a 5-year period. Of those kids, a third of them did not die because of their cancer or because of their disease. They died because of something that was a complication or a side effect of the cancer or the treatment. Supportive care, if we can even halve that, is going to make a bigger difference than most of these fancy new chemotherapies that we're inventing. If we can make a real difference to how supportive care is delivered, the things that we do during supportive care, we can save lives. We can massively improve the quality of lives going through treatment. And if we mean that there's less acute toxicities, short-term problems, will probably lead to fewer long-term problems as well, 10, 20, 30 years out. Investing upfront in making all those things better does make an enormous difference to the lives going on. So how do we make a difference to supportive care? Well, we do research. We do research in so many aspects of cancer care and cancer treatment, but we haven't, until the Candlelighters Supportive Care Research Centre came along, we haven't had anywhere in the world a centre that is purely dedicated to supportive care research for children and young people with cancer and stem cell transplant. What we're doing is we're making the good research get into practice better. We're looking at implementing research. We're doing really high quality research, both in new studies and studies where we draw together the whole world's knowledge and experience, turning those into systematic reviews where we know what we know what we don't know, and we know how to make things better in terms of the research going forwards. And we're also really, really interested in getting more people doing supportive care research. And so one of our missions is to develop people and bring them through from researchers or from junior clinicians into being experienced clinicians who know how to do research and know how to do it high quality. And like all other cancer care, all other cancer research, this is a collaborative and international venture where we're drawing together people from all corners of the globe to make this work and to make this better. The Candlelighters Supportive Care Research Centre is a way to absolutely accelerate progress in taking this forwards, and it's led by what the patients and their families want. We've done work developing how to get that information, how to understand and how to translate things back to families, and that's made our research studies so much better, so much more effective and meaningful. We're researching the stuff that matters to the clinicians, to the researchers, but also the patients and their families. I mean, that's what all research should be doing, but it's still relatively new that we do that, and we're really at the forefront bringing that forward.